Solving pharmacokinetic calculation can be challenging for some students. So in this video, I like to present simple step-by-step approaches how to solve pharmacokinetic calculation using pharmacokinetic equations. And especially in this video, I like to present most frequently tested pharmacokinetic calculations. So therefore, listen this video several times and repeat it. And I'm confident after this, you will be confident in solving pharmacokinetic calculations. So let's start. Here is the most frequently tested pharmacokinetic calculations. Here, first one, start off with half-life calculations. Half-life by using elimination constant, which is a T half equals 0.693 by K elimination, and other half-life calculation by using volume of distribution and clearance. So I'll discuss this in detail. I'll take a sample of those calculations. I'll discuss how to solve them. And then also in this video, I like to discuss about elimination rate constant. From those elimination rate constant, most tested questions are about using clearance by volume of distribution, or if you have two different concentration at two different points, you can also calculate the rate of elimination or rate of elimination constant. And the next calculation would be on the drug concentration, calculating the drug concentration at specific point, and especially for those drugs, those follow the first order kinetics. And there are two equations here. I'll be using those two equations to demonstrate how to calculate those calculations. And then also I'll be using drug clearance. So by using dose and area under the curve, and also additionally for oral drugs, clearance also will be showing us demonstrating example how to calculate them. And at the end, I'll be demonstrating you how quickly you can calculate the steady state concentrations by using rate of infusion over clearance. So first, let's start with half-life. Well, half-life is the time it takes for a drug plasma concentration to decrease by half. So basically, the drug concentration will be half in the plasma or in the blood. So here, this formula utilizes the elimination rate constant. Elimination rate constant is the rate at which the drug eliminated from the blood. So by using this constant and also 0.693, it helps you to calculate half-life. So here, let me start off with this example. A drug has an elimination rate constant of 0.1 hours inverse. What is the half-life of the drug? This is one of the most frequently tested question about the using elimination rate constant. How do you calculate the half-life? So use this one. So here there are options: A, 6.93 hours, and B, 10 hours, C, 7.5 hours, D, 5 hours. So here I am giving you formula on the right hand side. So using this formula, you can calculate the half-life of the drug that is given with the elimination constant. So larger the elimination constant and the rapidly drug eliminated. So here, in this case, calculate this half-life by using this elimination. So you can pause the video and then you can find the answer. All right, so correct answer here is 6.93 hours. So just plug in those elimination rate constant that is given 0.1 hours. So 0.693 divided by 0.1 gives you 6.93 hours. So therefore, that's the fastest way to calculate this half-life by using elimination rate constant. So next, here's another question which is also followed for the half-life. In this one, you will not be using any formula, but you would find how to calculate the half-life. So this is one of the most commonly tested question in the board exams. Here question is given, the half-life is 6 hours, and question is asking how long it takes a drug plasma concentration to drop 25% of the original volume. A, 6 hours, B, 12 hours, and C, 18 hours, D, 24 hours. So guess your answer, pause the video and guess your answer. All right, so here you may not need to use any formula. I know it can be used also by using equations, but in this case, I would not use any equation to calculate it. However, simply here it says 6 hours is half-life. So in first half-life, drug becomes 50%. That means start from original concentration. Original concentration is always 100%. So 100% become 50% in 6 hours, and another 6 hours it becomes 25%. So therefore, to drop to the original volume 25%, so here 6 plus 6 hours, that gives you 12 hours. So the correct answer is 12 hours. All right, let's say another question related to half-life, which is often utilizes the volume of distribution and clearance. What that means is volume of distribution represents the theoretical volume in which drug is distributed in the body. Means compared to blood or plasma, how much drug is distributed to the rest of the body, like tissues, organs, all those peripheral systems. All this distribution is volume of distribution. And if you know how much drug is distributed, and then you have a clearance. Clearance is the rate which the drug is removed from the body, like how fast it is removed. So if you know how much it is distributed and how fast it is removed, then you can tell how much time it takes drugs to be 50% to be eliminated. So therefore, using this formula, you can calculate. Here is another calculation. A drug has a volume distribution 50 liters and clearance 5 liters per hour. Calculate the dosing frequency to maintain therapeutic levels. So here are A, every 2 hours, B, 5 hours, C, 6.9 hours, D, 10 hours. So this is the standard formula. This formula also helps you to calculate the dosing frequency. Means after giving a one dose, when the second dose is given. So pause the video and calculate it by using this formula and find your answer. All right, so here after using this formula, so if you plug into those, volume of distribution was 50 liters and the clearance is 5 liters per hour. So correct answer is 6.9 hours. All right, let's look at the another equation that are commonly used for calculating elimination rate constants. So elimination rate constant, which is that tells you that how quickly a drug is cleared from the body. So if you want to determine how quickly it is cleared from the body, then you utilize clearance and volume of distribution. All right, so then in this also formula you have a CL, clearance. What it means is clearance is the volume of plasma from which the drug is removed per unit time. And then of course, how much drug has been spread throughout the body. That is the volume of distribution. So if you have these two, then you can calculate how quickly drug is cleared from the body. So let's look at one example. What is the elimination rate constant for a drug with volume of distribution 10 liters and clearance is 1000 milliliters per hour? A, zero point 0.2 hours inverse. That unit for elimination rate constant is a 0.2 hours inverse. B, 0.1 hours. C, 0.5 hours. D, 1 hour. Here you can use this formula and pause the video and quickly calculate and find your answers. All right, so here one thing you have to do additionally, the clearance is given in milliliters per hour, whereas the volume of distribution is given in the liters. So that's the reason why you have to convert clearance milliliters to liters. So 1000 milliliters equals 1 liter. So now you plug in that and it gives you 0.1 hour inverse. That's the correct answer for this calculation. All right, let's look at the next calculation, that is for bolus drug concentrations. And there are two formulas here. One is calculating initial drug concentration, gives you dose by volume of distribution. And then this formula, which is the most frequently tested in the exam, and this formula is used for calculating the drug concentration at specific time when the initial concentration and elimination rate constants are known. So what that means is, if you are given a elimination rate constant and then time and also initial drug concentration, then you can calculate the uh, drug concentration at that particular time. Like after infusing the drug certain time, how much drug is present in the blood. So if you want to calculate, this is the go-to formula. Alternatively, there's another formula. You can also calculate the same thing. That is but using the logarithmic base 10, which is using this formula here. So basically, this formula utilizes same as here. However, you use this log 10 in this case of this formula. So let's see, this is the one of the most frequently tested, and therefore I would go step by step and show you how to calculate it. So here in this case, this is the question. All right, so here is the question. For a drug with initial plasma concentration, which is C0, which is 10 milligram per liters, and the elimination rate constant is 0.2 hours inverse. So the question is, what will be the plasma concentration of the drug after 5 hours? So here you got plasma initial concentration, elimination rate constant, and the time after 5 hours. So utilizing that, you can calculate this one. So if you have options here, options are A, 2.5 milligrams per liter, B, 1.8 milligrams per liter, C, 3.6 milligrams per liter, and D, 4.2 milligrams per liter. So here, this is the formula that can be used, which is one of the most commonly used formula. So here we are not using log 10. Instead, we are using exponent, which is the exponent of minus k elimination constant and time t. And C0 is a initial concentration. So now pause the video for a short time and then calculate this question by using this formula and figure out your answer. All right, so here I like to give you additional information. So K elimination in the question is 0.2 hours per inverse, that is given here. That's a question. And then time, total time here is 5 hours, means this question is asking after 5 hours, what will be the drug concentration? So here 5 hours, and now plug in this K elimination and time into the exponent. So if you do that, if you do this 0.2 multiplied by 5, it gives you 1. So you have exponent of minus 1. So what that means is, now use the calculator and punch this exponent sign and then first enter the minus and then 1, and then press the exponent sign in the calculator. It gives you 0.36. And once you get that 0.36, and then here you have C, which is the initial concentration was 10. So multiply 10 times 0.36, which gives you 3.6 milligrams per liter. So therefore, the correct answer here is 3.6 milligrams per liter. So use this method, practice once or twice. I am confident you will be good at solving this question. However, less commonly used is a log 10 method. However, you can also use that one, but I prefer to use by using this method. So one of the two method is still okay, but this is the most commonly used method. All right, so let's talk about the next, calculating the drug clearance. So here you have two equations for calculating drug clearance. For drugs, intravenous drugs, you can use simple clearance formula as dose by area under the curve, or oral drug administration. This is the most widely used if you have a bioavailability. So here F is the bioavailability, AUC, area under the curve, and generally this is given for F is bioavailability is given for oral drug, and then multiply with the dose and divide by area under the curve. That gives you the drug clearance. Drug clearance is one of the most commonly tested question as well. So here is the one question. A drug is administered at the dose of 600 milligram, bioavailability is 1, area under the curve is 60 milligrams per hour per liter, and question is asking what is the clearance of the drug. So use this formula and pause the video and calculate your answer. So here is the, if you plug in this into the question, and here is your answer. So it comes to be 10 liters per hour for this clearance of this question. So this is the formula or equation of this clearance is very effective in solving this question. All right, so let's do the another commonly tested question is uh, in the infusion drugs to calculating them steady state concentration. This is the widely used steady state concentration formula. That means plasma concentration at steady state. What is the concentration when you have a steady concentration of the drug in the blood? So in this one, here you will be using infusion rate and also the clearance. Clearance is the volume of the plasma which drug is removed per unit. So this is the very frequently used formula and also frequently tested question in the exams. And also here alternatively you can also calculate a rate of infusion. So rate of infusion or can be also calculated by doing those changes in the steady state concentration to the multiply with clearance. All right, so here is the one question that helps you to figure out how to use this formula. A drug is infused continuously at rate 20 milligram per hour and clearance is 4 liters per hour. What is the steady state plasma concentration? Well, use this formula, which is a rate of infusion divided by clearance, and pause the video and calculate and see what would be your answer. All right, so here is the answer is 5 milligrams per liter. That's your best answer by using this steady state concentration. Here, and I like to present another good question, which is a big in the exams about this steady state concentration. So this is the last question for this video. So drug A with pharmacokinetic parameter that is a volume of distribution 250 liters and clearance is 100 liters. And when would reach this steady state concentration? So question is asking here how long it takes to reach this steady state concentration. Well, our answers are 1 day, B 2 days, C 3 days, D 8 days. Well, now here I'm giving you this formula. And guess what would be your answer? I know this question is formula is only gives you elimination rate constant. So it will not give you the how many days it takes. However, the big thing here you should know here is by using this elimination rate constant, you also can calculate half-life. Once you know the half-life, then you can calculate how long it takes. Generally, to reach to the steady state concentration, it takes 5 half-life, 4 to 5 half-life. That way you can calculate. So now calculate this. I'll pause the video and then find your best answer. All right, so now let's first plug in this, the clearance and volume of distribution. It comes to be 0.4 days. So what is that 0.4 days? Is 0.4 days is a elimination. So that means you plug those 0.4 elimination rate constant and then divide by 0.693, which is a t half. It gives you 1.4. So this is not a 0.4 days, it is a 0.4. So now if you calculate that, it comes to be 1.7 days. So this is the half-life is 1.7 days. And then approximately to reach drug steady state concentration, the standard is about 4 to 5 half-lives. So let's take it 5 half-life. If you take a 5 half-life, it comes to be 8.6 days. So therefore, the right answer here is 8 days. All right, so with this most frequently tested question, I am confident this video will be helpful in your exams preparation. So therefore, stay tuned for more videos with graph and other more pharmacokinetic calculations such as first order, zero order calculation. So stay tuned and also subscribe Pharmacy Prep channel. Thank you for watching. See you soon.